Hello, I'm Dr. Vannessa Davis, a nurse practitioner in psychiatry and family medicine. I am doctorate trained nurse practitioner and I've been in practice for several years.
What inspired you to get into the mental health field?
Well, actually, what really inspired me, I first was certified in family medicine and I specialized in nephrology, but I saw a lot of my patients with kidney disease coming in with a lot of depression, anxiety, other mood disorders that I was not able to really understand it properly. I know as a family practitioner, you have that training where you can still treat them, but some of the psychiatric medications and what is really going on, I really wanted to get in the depth of it, and that kind of motivated me to say I want to be an all-round practitioner that I can better understand what my patients are going through when it comes to their mental health, especially when I tell them they're being diagnosed with a chronic disease such as kidney disease that at the time is already frightening, where they don't understand what is going on, and then I tell you, oops, your kidney is failing, and then you go, what next? And I'm looking at you because I'm going to tell you in the medical standpoint of it, but in the psychiatric point of view, I really did not, I wanted to master it. I understood it, but I wanted to master it and be that provider for them.
Can you tell me a little bit about your own mental health journey?
Well, my mental health journey, I am a second generation immigrant, and I'm going to tell you in the immigrant community, especially those from Africa, West Africa particularly, mental health is a lot of denial. So when you ask me who in my community suffers from mental health, we're going to tell you, no, we don't have it, because they're going to tell you don't have it. But you can see all the symptoms. You can see everything else that, and especially I remember I did a piece before on mental health in the African American community of African origin. You see that the way they exercise or express their own mental health is through substance use, especially because of that denial. They turn into drinking alcohol, especially because again they don't know how to manage it, and you can come out and tell people I have anxiety, or I have depression, or I'm suicidal. And then recently we have a big loss in my family where my mom passed, and I saw that with my siblings, and I saw people suffering from even suicide ideation in the family. But because of the denial and things people were denying and telling the others, snap out of this and get out of this, and all of those things, it's kind of strange when you see that as a mental health professional. You see people are suffering, people are struggling, but then in your background there's a lot of denial where nobody is accepting it. And me, for one, as a mental health practitioner, when you suffer, like I see people with neurodivergent disorders like ADHD, and you see all those symptoms in you, and you go, oh my God, is this what was really the case, why I was so prone to accidents and nobody really know what is going on? Or is this what was going on with me, where I can't sit still, or you blooded ulcers? In class they always say you quick to jump up because you just couldn't hold yourself. And growing up where in a community, in a society where nobody even paid attention to that, how kids with those neurodivergent disorders really, really suffer, because you get punished a whole lot because you couldn't sit quiet, because you
Yeah.
couldn't sit still, because you couldn't listen to the teacher. Not because you don't want to, your body just is not, your brain is not telling your body what to do, so you really cannot do that.
What is it like helping others?
It is the best thing to ever do. I will not tell you that the smile that comes to my face when I see somebody coming to me very depressed, very suicidal, very anxious, or whatever symptoms they're presenting, and then in a few months after working together, using both psychotherapy and medication, especially those two together, then you see the improvement. And somebody said, all these years I've been looking for something like this and I never got to it, and finally, like, whew, this is a relief. That gives me joy, and it gives me joy to save a life, because I know when you do mental health, you save a life. When you are so depressed, you are at risk for suicide. When you have bipolar, you have personality disorder, you are at increased risk for suicide. So when I see that because of my intervention your symptoms are relieved, I know that I have saved a life, because you have moved from that suicidality to enjoying life and enjoying it to the best of your ability.
Yeah, with that, I live with bipolar disorder too, and I didn't get treatment till I was 37, and I'm 42 now, so only 5 years, and I feel completely different. How important is it to talk about mental health and get help early on in life?
Well, Mike, thank you. That is a very, very important question because a lot of times people don't know that early intervention is key. Early
Yeah.
intervention is key in every aspect of health, whether it's physical or mental, and especially in the mental health spectrum where it's an internal suffering. When you have a mental health disorder, it's internal because, first of all, because of shame, because of societal way they look at things, you become so closed in where you can't even tell, not even your family members, because they're going to laugh at you, or your friends, or even at work you can't tell somebody, I'm suffering from anxiety or I'm suffering from depression. You can't even mention it. So that becomes an internal battle and an internal struggles. Therefore, when you have that avenue where you're expressing it and you hear people talk about it, and that is why with us at Bethany Head we are talking about it, because when you talk about it, you bring that understanding to society that if you are suffering any of these symptoms, do not hide. You are not unique, you are not alone. There is help, there is support, and therefore we want to bring that recognition to the public.
Have you seen your clients' confidence level rise as they go through the process?
Oh, yes, I cannot tell you about confidentiality. Confidentiality is key. And I tell everyone because a lot of times I want to know that when I go to a provider's practice, or I go to any setting in terms of medicine or mental health, my information is not out there in the public, because
Yeah.
this day is the time of social media and everything is out in the public.
Yeah.
And I tell people, whatever you share, that remains in here. So that space is a very, very unique and confidential space. Therefore, when you bring the information here, is what you tell people, that's what they're going to know. But what you share with us at our practice, it stays in that practice and we don't divulge no matter to who. Therefore, even when I'm seeing children, especially teenagers, I tell them whatever you share with me is confidential. That is very important because they want to know that I don't want to come to you and say I'm cutting, because when they have bipolar or personality disorder, they cut. That's part of their coping mechanism, which is unhealthy. But they don't want to come out and tell you I'm cutting, and then the next thing you know, their parents is targeting them at home. Yes, you started cutting again, because again, there's emotion involved in that when parents are taking that route. So therefore, when they know that it is confidential what you share with me, and I do tell parents as well, and I tell spouses and family members, listen, whatever we talk about, do not expect me to divulge to you, and don't ask me about it because I will not tell even if you do. So that is a key with us, and that is very important.
What do you do to help your own mental health?
I see a therapist. I tell people everybody needs a therapist, even if you do not have a mental health disorder, because life happens. Things happens. All the time something is going to jolt you out of balance. You could lose a loved one. You could lose your job. You could have somebody sick. You could lose a friend. You could, anything can jolt you out. You could be in financial crisis. When that time happen, you know why we do fire drills at work and things? Is because we prepare for the fire. It doesn't say that we have a fire right now, but we're doing a drill, which is preparation for when the fire occurs, so you know what to do. They don't keep fire drills until when there is a fire before we do fire drill. It's the same thing with mental health. So I encourage everyone to seek therapists, talk to your providers. I do have one, because you need that space such that when crisis comes, you already have it in place. You don't want to be looking for it when I'm in crisis. That would be chaotic. So yes, I take care of mine. I do the things that I have to do. I exercise, I eat right, I sleep well, I meditate, I do yoga. While I'm doing all of those mind-body connections, I also have a therapist that I talk to regularly just to make sure that as I'm going through life occurrences, it's not overwhelming me. As I listen to my patients, it doesn't overwhelm me as well. So the one advice I'm going to say, everyone needs a therapist.
I completely agree. I have one as well.
Good for you.
Have you seen the stigma of just talking about mental health lessening?
Stigma lessening is going to take us a while.
Yeah.
It's going to take us a while because people are still getting adjusted to it. People are still getting used to it. So, have I seen the stigma lessen? Yes. The reason I say that, for the month of May at Bethany Health, we do a live Facebook mental health discussion every day from 12:30 for 5 to 10 minutes. I've been seeing more and more people are getting to view that page. That is telling me people are hungry for knowledge. People are hungry to be heard. People are hungry to be seen with their mental health disorders. So with the stigma reducing, I think slightly in my over 20 years in practice, very minimally I have seen that, but we still have a ways to go.
What are some of the things that you've learned from your fellow therapists at your organization?
Well, the one thing I have learned is keep calm. Keep calm when there is turmoil, when there is tornado around you. Keep calm. And I will tell you this, I have fellow colleagues and even my own therapist. When you go and you're rattling, oh my God, do you know what this is? All they do is just listen. So when you have a tendency to listen and be positive and be encouraging, that makes a world of difference. Like, I will take an analogy here. We live in New England, and in New England it snows. If I wake up every morning, I said, it's snowing today, and I'm looking very sad. It's snowing today, it's terrible, I can't go, the roads are bad, this. As I'm saying that, is dampening my mood. And when you hear me say that, you're going to feel the same because you've just followed suit what I've been telling you. But if I wake up every morning, it's snowing today, it's beautiful, it's white outside, I'm going to make snow angel, I'll make snowman, I'll have a snow fight, I go skiing, I go horseshoeing. You know, I'm saying this with all excitement. You're going to think that snow is heaven. But when you start looking at it from a negative perspective, it's just going to dampen your mood. So that is why I said be positive. No matter the situation, be positive. Find the positive aspect of that one thing that is going wrong. And it's going to make a lot of difference in your outlook.
Where do you want to see your mental health mission, say, in the next 3 to 5 years?
My mental health mission is to get everyone aware and seek treatment. Because when we seek treatment, we're going to save a life. We're going to prevent a lot of recklessness. Because you see, sometimes we have accidents on the road because people have mental health issues. That's why you see they're prone to accidents. We see sometimes this senseless killing and hurting of people is because of mental health disturbance. So when we bring this awareness and bring treatment to the public, it's going to decrease that and save lives.
How can people reach out to you and learn more?
Well, you can reach out to us at Bethany Health Services at 603-601-4766, or you can go online on bethanyhs.com. Bethany, like the name Bethany, hsharrysam.com.